we need to go above and beyond just considering estrogen as a reproductive thing. It's not just for making babies or giving people boobs or whatever it might be. It really has to do with your overall picture of health, your heart, your head, your bones, your sex life. All of these things are really important and have a great reliance on your estrogen level. So we need to look past just blocking estrogen for blocking cancer. You don't need it anymore because you're not going to have any babies. We need to move past that and look at what is this impact on the rest of your life. Today, my discussion will be about how to choose if hormone blocking therapy is the best thing for you and what to do to make it better if you do choose to do hormone blocking therapy, and to really kind of give you a perspective on, are there natural alternatives or what in general can be done outside of hormone blocking therapy to reduce your risk of breast cancer or other types of hormone responsive cancers coming back. And the thing is that a lot of women are put on hormone blocking therapy because the science as we know it right now, it is one of the top therapies that we have to help reduce the risk of cancer ever coming back. In particular, I'm going to say breast cancer a lot, but perhaps if you have a type of ovarian or potentially even endometrial cancer, if you're put on any sort of hormone blocking therapy like estrogen blocking therapy, then all of this is going to apply to you. But just breast cancer is going to pop out of my mouth because that's typically what we support people with when it comes to these conversations. But the information mainly will apply to you as well. So really, there are several types of hormone medications, hormone blocking medications. They generally fall under two classes, one being aromatase inhibitors and the other being SERMs, selective estrogen receptor modulators. Aromatase inhibitors are, you might have heard, like Letrozole, Anastrozole, Exemestane. And then we've got the SERM, the main SERM being Tamoxifen. And how they work in breast cancer is they can basically reduce the possibility of estrogen reaching the breast cancer cells that might use estrogen in order to grow or create more of themselves. Because there are, like an ER positive breast cancer, the ER positive means that they are they're positive for the estrogen receptor, and they want estrogen in order to encourage their own cells to grow and to potentially even cause other types of cancer cells to develop. But mainly, the estrogen causes the breast cancer, ER positive breast cancer cells to grow. And so whenever we apply something like a SERM, let's go with tamoxifen, what happens is that the tamoxifen is going to block the estrogen from reaching those ER-positive breast cancer cells because it's blocking estrogen from reaching the breast tissue. But the estrogen is still going to reach things like the heart, the brain, and the bones, which all of those organ systems do require estrogen in order to be healthy. And we'll go into why that is in just a minute. Then we've got aromatase inhibitors. And what aromatase inhibitors do is they actually block estrogen from being made in the body. They block estrogen from being created, which means that there's no estrogen reaching any of the tissues, so including the breast cancer tissues that are going to want it to grow. And typically tamoxifen is given in someone who is premenopausal, meaning that they should still have some circulating estrogen because we still need the estrogen to encourage the growth and health of bones, heart, and brain. And someone who is postmenopausal will typically have a lower level of estrogen anyway in their body, and they don't really need the estrogen according to conventional standards. So giving an AI, which prevents any potential for estrogen being created, lowers that even more, is the best method because it's okay if there's already a low amount of estrogen reaching the brain, heart, and bones. So just to recap, we've got tamoxifen, typically premenopausal. Someone still should naturally have some hormones circulating. So what it does is it focuses more on blocking the estrogen from reaching the breast tissue. And then we have aromatase inhibitors, usually given to someone postmenopausal. That's your Exemestane, Anastrozole, or Letrozole, and there's a couple others too. That will kind of prevent estrogen from being made or lower the amount of estrogen in the body in general, meaning that it's not going to reach any tissues, including the breast tissue, and it will not encourage cancer to grow. The problem with these medications, which you may know already, whether you're on hormone medications or not, you can probably even take a guess of what happens whenever you have lowered hormones or estrogen in your body, is the quality of life for women is drastically being impacted being on these medications, or in general, when women go through menopause, their quality of life can decrease too. What happens is you get hot flashes, night sweats, joint pain being a big factor for why people really don't like taking these hormone medications, brain fog, things like that can all be due to the lowering of estrogen in the body because estrogen plays a role in all of these places. So, for example, women will experience joint pain because estrogen is actually anti inflammatory. It can help to decrease inflammation of the joints. It also helps in creating this synovial lining, which is basically the cushion of the joints. So, whenever you don't have estrogen, that cushion gets reduced. And it also helps to maintain cartilage, again, helping with the building of the joints. So, whenever we have estrogen being reduced, whether it is through blocking estrogen from being made, like an aromatase inhibitor, or sometimes with the tamoxifen as well, then you're going to have pain of the joints, joint pain. People get hot flashes because estrogen plays a role in temperature regulation. They often will get brain fog because of the role and protection of estrogen on the brain. So, all of these things cause a dramatic change in the quality of a woman's life. And the way that it's managed right now is absolute crap. We do not have an appropriate system to support women through these hormonal changes, whether it's just even simple natural menopause or if it's due to an abrupt menopause, quite often due to these hormone blocking medications. So, we really need to do better for sure in the medical system. And I have been seeing a lot of amazing doctors out there in the last even couple of months really shouting from the rooftops that we need resources, we need support when it comes to helping women manage this. And I see a great change happening in the next couple of years even. So there's still a lot of hope here. But let's just basically go through a little bit more the impacts. And then my goal, again, is to dive into how to help you to decide if hormone medications are best for you and all the things you need to assess. Because as you kind of may have heard me say already, kind of alluding here, is that there are a lot of positive benefits for estrogen in the body. And sometimes it feels like you can be stuck between a rock and a hard place. Of course, you don't want to encourage breast cancer to continue to grow, but of course, you also want to live a fantastic life. You don't want to suffer from these side effects. And you want to make sure that you're not just blocking breast cancer and then getting heart disease or dementia or bone fractures, things like that. So I'm going to really, truly teach you how to navigate all of this in this episode. Just listen in to the very end. All right, so estrogen blockers can cause bone fractures. I already did a full episode on bones, basically, and I talked about estrogen too. Estrogen has to do with the building of bone and the breakdown of bone. I'm not going to go into it right now, but I will link to that episode. It is, I believe, exactly the episode I just did before this one, so I'll make sure that you guys get access to that. That's where I'm going to talk about osteoporosis, osteopenia, and supporting bone health in that one. Whenever it comes to heart health, estrogen helps with relaxing arteries. It helps with lowering bad cholesterol, helps with increasing good cholesterol. It helps with regulating triglycerides. Again, estrogen is anti-inflammatory. All these are important for reducing the risk of getting cardiovascular disease, heart attacks, and strokes in the long run, too. So you're blocking estrogen, you're going to have an increased risk of heart problems in the long run, too. Heart disease being the number one cause of death in people in North America, right? So we don't want to survive breast cancer just to lead you into a cardiovascular event for sure. So we're talking about that today. The other side is brain health. Estrogen, again, anti-inflammatory. Estrogen also plays a great role in glucose metabolism, and we know that glucose metabolism is very important for the health of the brain. Your brain will use glucose as a fuel source, as well as if we have poor glucose metabolism, it's going to increase inflammation throughout your whole body, including your brain. And we now know that there is a component of glucose metabolism, even looking at like diabetes and its role in increasing one's risk of dementia. So if we're going to get rid of estrogen, we're going to cause glucose problems, and then we're going to have an inflammatory impact on the brain due to glucose problems and other reasons as well, just the fact that estrogen is anti-inflammatory. Not to mention that estrogen helps to make things like the neurotransmitters, the serotonin and dopamine work better. So it can also play into your mood alongside dementia and Alzheimer's, things like that. So I'm hearing a lot of this come up, and I'm so glad that you are asking this because it makes complete sense. And I don't know why people don't address this more, but you are starting to ask, all the listeners, all of our clients, they're starting to ask, like, how do I decide to do this whenever I know that estrogen has all these positive benefits? Is there a natural alternative to help support my body instead to block cancer from coming back? Is there ways to manage estrogen more naturally, more functionally, so that I don't have to take these hormone blocking medications? And you know what? As it stands right now, I have some not great news, but I have some strategies moving forward. So hear this, not great news, but know that there's more coming that you can actually act on. The not great news is that the problem is there's really not enough information out there on natural therapy saying, yes, natural therapies that don't have these drastic side effects that aren't going to cause cardiovascular disease, brain problems, bone problems. Yes, we know for sure that applying these natural therapies are going to reduce the risk of cancer coming back. We do not have that evidence available right now. As far as I know, it's not even being studied. Lots of reasons for that I'm not going to go into right now. So as it stands right now, I do not feel comfortable saying that here is your supplement, here's your nutrition plan, here's what we're going to do, and this is going to help you to reduce your risk of breast cancer coming back as good as tamoxifen or as good as letrozole. So we just don't have that information right now, and I don't think anyone should be saying that we do. You're going to come across people like, well, I came across this influencer and they said that this has been shown to reduce this as much as tamoxifen. But if you dig into that research, it is not great. It is on cell cultures, animal studies, and if it is on humans, you can think of there only being a handful of human studies showing the impact of natural therapies, but we've got hundreds, if not thousands, of papers showing the benefits of hormone blocking medications. We cannot compare thousands to 4 papers, basically. We need more information than that. A lot of those papers are also old. We just need new stuff. And I'm not saying that doing these things aren't beneficial. I'm saying that we cannot say for sure with numbers as solidly as we can say with hormone blocking medications that we can reduce the risk of breast cancer coming back with these natural therapies. I still fully believe that they have great benefits for sure. So instead of relying on these natural products, trying to get specific supplements or incorporating certain phytoestrogenic foods or whatever it might be, I want you to do all of that, but I also want you to go even the next level here. And I think how many points do I have to go through? 1, 2, 3, 4, 5, 6. I have 6 points to walk you through. And this is like basically the method, the thought process that I want you to work through to start to kind of quantify your risk of breast cancer coming back and your risk of not having estrogen in the body. I want you to see the pros and the cons of both. And you can actually get some numbers here. You can get some solid evidence. There is research out there, just people aren't putting it together appropriately for you. So that's what I'm going to do right now is I'm going to walk you through the strategies, the thought process to follow in order to say, should I take this hormone medication? Or if you are on one already, should you continue the hormone blocking medication? So let's get started. I'm so excited about this. All right. So the first thing I want you to do is to really understand your benefit of taking the hormone blocking medication and the benefit in terms of how much is it actually going to reduce your risk of breast cancer coming back. You can do this if you've had an Oncotype DX or a mammoprint test done, and you probably have had it done, and it's possible that no one just brought it up with you. It's possible that they have as well. They probably have and you've forgotten about it because there's just so much information to process. But I want you to go to your oncologist or potentially even your general practitioner. I want you to get them to pull up your Oncotype DX or your mammoprint test results. Oncotype DX is my favorite. It is a little bit more comprehensive. And I believe even if they still have tissue samples, if you've had a lumpectomy or any sort of surgery or biopsies or anything like that, if they've kept the tissue sample, they can still perform this test. So I want you to get those results from your doctor. And you're going to ask them, what is your relative risk reduction and what is your absolute risk reduction? And you're going to get them to explain what do those two numbers mean. I'm going to explain to you what relative risk reduction means because sometimes it sounds so fantastic and then you actually learn what it truly means and you're like, oh, it's not as fantastic as I thought. It's still good. And when it comes down to it, only you can decide what that number means to you because I know that I've had some women who's like, this medication will reduce my risk of breast cancer coming back by 2%. And I want that medication. I want that 2%. And I've had other women read that same information, get that same number, and they're like, I don't want that 2%. I don't care about that whenever I feel like crap all the time. I can't think, whatever it might be. So I want you to analyze what the numbers mean for you. But first, you got to figure out how to analyze those numbers. So let's get into that. So let's just say that whenever you look at your risk of cancer coming back, typically you can find out, do you have a risk reduction of like 5 to 50%? And what does that mean? Typically, most of the risk reduction is 30 to 50%, which sounds amazing, right? But here's the thing, often that is your relative risk reduction. So let's say that you can see that you have a absolute or a risk reduction of 10%. Someone tells you, they read your Oncotype DX scores and they're like, yeah, your risk here, your risk of cancer coming back is about 10%. If you look at your relative risk reduction and it says that if you take this medication, you will have then a 50% relative risk reduction in recurrence rates. If your initial risk of cancer coming back is 10% and you have a 50% relative risk reduction, you're going to lower your risk of cancer coming back to only 5%, because that's 50% of your 10% risk of cancer coming back. I'm going to say that again because if anyone's brain works like me, I'm very visual. Also, numbers kind of scare me a little bit. It takes me a little bit more time to process it. And sometimes I'm not great at explaining it, so let me explain it a second time. So let's say you were told that your risk of breast cancer coming back is 10%. And then they say, though, if you take this hormone medication, it's going to reduce that by 50%. Then that means that your risk of cancer coming back is then going to change into 5%. The risk of the cancer coming back is going to be 5% because it's 50% of your original 10% if you weren't to take the hormone medication. If you are to take the hormone medication, then it's going to be a 5% risk of your cancer coming back. So again, what does that number mean for you? And that's what it really comes down to is that 5% risk of cancer coming back really huge to you and you want to dive in and do extra in order to make sure that it doesn't come back? Or you're like, the 5% doesn't matter. I've tried the hormone medications. I've got the hot flashes. My joints are incredibly painful. I just don't feel like it's going to work for me. So I'll take the 10% instead of doing the hormone medication. You are allowed to make the decision based on what you want to feel, and it's okay, and it's up to you. I'm not going to go into it in this episode necessarily, but if you've taken the hormone medications, there are options for you to manage those side effects. So sometimes it might be more wise to play around with how to manage the side effects. I am doing a breast cancer workshop in a couple of weeks. It is, you can learn more over at flourishaftercancer.com/breast cancer workshop. I will go further into detail on if you have side effects from these hormone medications, what can you do if you wish to stay on them? Because sometimes if we can get you to stay on the hormone medications, then that's fantastic. We do want that added risk reduction, but you have to figure out that balance between, is it beneficial with the side effects or do you really want to just skip the medication? So again, check your Oncotype DX, check your mammoprint, look at your relative risk. They even have absolute risk as well. I will have a handout for anyone who signs up for that workshop, just further explaining absolute and relative risk a little bit more clearly, or you can have your medical doctor explain it to you. All right. So we talked about actually knowing if the hormone medication, its reduction is going to benefit you or not. How do you feel about that? Go in your Oncotype mammoprint tests. But let's now look at what is your risk of other medical conditions if your estrogen was to be lowered in your body. So we're going to talk even more into detail on what is your risk for heart attack and stroke. How do we analyze that? Looking at bone fractures, your bone health, as well as your dementia, brain health, and a few other things as well. So let's see if we can look a little bit further into, like, if you go on hormone blocking medications, if you lower your estrogen, are you going to therefore now greatly increase your risk of having a heart attack or a stroke? Because to be quite honest, more women who have received a diagnosis of stage 0 to 2 breast cancer, they are more likely to die from having a heart attack or a stroke than they are to die from the breast cancer or breast cancer recurrence, especially if they're around the age 50 and above. So we don't want women, again, to go through breast cancer and then to be so caught up and wrapped up in blocking estrogen and stopping breast cancer from coming back to then die from a heart attack or stroke. We can go so much further into this, and there's so much we can do. So the first thing you're going to do is look at your risk factors. So you can look at your family medical history. Do you have a mom, a dad, a brother, sister, even an aunt or an uncle who has died from heart attack or stroke? Do you smoke? Do you drink a lot of alcohol? Are you sedentary? Have you already had your cholesterol checked and it's high going into taking the hormone blocking medication? Are you already on a hormone blocking medication and your your cholesterol keeps creeping up and up? Another thing to add on to your cholesterol panel is looking at something called lipoprotein little a. And this gives us more of like, are you at a greater genetic risk of developing high cholesterol and then leading to a heart attack or a stroke over time? So we can dig deeper and look further than your current health status. We can look at your family medical history. All these things need to be taken into account when we're saying like, are you just going to block breast cancer and then end up with a heart attack or a stroke? So again, we want to look at your family medical history. You want to do your full cholesterol panel, including lipoprotein A. Are you a smoker? Do you drink? Are you willing to change those things? Do you have a sedentary lifestyle? Do you need to work out? Are you overweight? Are you diabetic? Do you have dysregulated blood sugar? And do you even know? Because a lot of the times people aren't even getting properly tested. We've had so many women who we do like full panels of blood work on, and we see that their HbA1c looks normal, which is the typical measurement that you're going to determine if you have diabetes or not. But then we also are looking at their fasting insulin, fasting glucose, and IGF-1. And we see that their fasting insulin is high despite having normal glucose or normal HbA1c. We see so many women with high IGF-1, which is this insulin-like growth factor 1, which plays into encouraging more growth of cancer cells, particularly breast cancer cells. So you might have been told that you're not diabetic, but you also potentially might need a more broad panel in order to determine more about your risk. Because when it comes to cancer, we shouldn't be fooling around. We should be gathering more data, going into more detail for sure. So cholesterol panel, lipoprotein A, fasting insulin, fasting glucose, IGF-1, and HbA1c. But I'm going to look more at your insulin, your glucose, if we're assessing, do you have dysregulated blood sugar? Are you diabetic? Things like that. Or do you have high blood pressure? All of these things will increase your risk for a heart attack or stroke. So whenever it comes to deciding if you want to block your estrogen or not, we have to take this into account. And even if some of these were high, if you are at a high risk, let's say that your benefit to taking the hormone blocker was also great. Are you willing to change? Are you willing to dive in and work on your cholesterol, your blood sugar, your weight, your food habits, take specific supplements on top of all that? Because you cannot take a supplement and expect full change in any of these things. We need you to change your nutrition, your lifestyle, all these kind of factors. Are you willing to change basically? And if so, then definitely we want you on the hormone blocking medication because we can start working. We can manage the cholesterol and the heart attack, stroke risk. The other thing is, like, are you really young? And you should be followed more closely over time too, whenever we're looking at your cholesterol markers. And we're going to talk about bones next. We should be following up with you more regularly. If you are really young at diagnosis, like I've got friends who are 30. I've got a lot of clients who are 30. Even sometimes we're hearing now women in their 20s quite often are being diagnosed. So if you're younger, I'm recommending twice yearly blood panels, basically to assess all these markers even if you didn't take the hormone blocker, because we want to make sure that if you're young, we're watching you so closely over time because we want to catch things as early as possible. If you're not young, I'm probably recommending twice a year because I'm very data driven and I want to know everything about you. All right. So recap, family medical history, smoking, alcohol, sedentary, your cholesterol markers, blood sugar markers. Are you willing to change? All these things let us know, are you able to lower your risk of heart attack or stroke if we were to mess around with blocking your estrogen pathways? And a quick little thing that you can even do online is you can go to cardiovascular risk calculators. One of them is the ASCVD. Basically, it's the American College of Cardiology cardiovascular disease risk assessment calculator, as well as the Framingham risk score calculator. They're all online. It just asks you a couple of questions to put in, like your age, your weight, all these kind of factors, smoker, non-smoker. The only thing about these is that it can typically underestimate the risk of cardiovascular disease in women who have gone through breast cancer because it's more geared towards just a general population. So we want to see generally what would be your risk if you hadn't gone through breast cancer, and then also kind of use a little bit of art and consider potentially that risk might be a little bit higher because of chemotherapies, which tend to be a little bit more heart toxic, and radiation to the breast area, especially over the left side where the heart is, might increase your risk of heart disease as well, just due to like scar tissue radiation, what radiation causes. All right. So we talked about heart health. We next want to talk about bone health. And people are like, well, what's really the problem with getting osteoporosis, osteopenia, and fractures compared to getting cancer again? People die from bone fractures. It's usually in their very elderly years, like maybe even just 80s, 90s, 70s for some people. But it's still a factor we want to look at. It also can impact your quality of life. You might not be able to do the things you want to do as much if you've got bone pain due to osteopenia, osteoporosis. If you're at a greater risk for fractures, there's certain sports, like maybe you can't go play pickleball as much because there's a greater risk of you breaking your arm or your hip or something like that. So quality of life is definitely a factor here. And then in the elderly years, we do want to manage making sure that you're not getting a fracture and then leading to death as well. So everyone should be getting a bone scan before they go on their hormone therapy, hormone blocking therapy, because we want to have a baseline. Are you already osteopenic or do you already have osteoporosis? We really want to check that out before we kind of look at decreasing your estrogen more, because estrogen has a role to play in bone health. Again, what is your family medical history? Did your mom or your aunt or your sister have any osteopenia, osteoporosis? That's more likely to play into you because you share genes. That's genetics, not pants. Um, and even you can have the conversation is like, let's say that I want to take the hormone medication and I am at a greater risk of osteopenia, osteoporosis. Is there anything I can do to prevent that? So there are definitely exercise strategies, vitamin D, diet strategies that can all improve your bone health. But there are also pharmaceutical medications, if you're open to that, that can prevent you from getting osteopenia, osteoporosis down the road. You can start them now, and then you're not as high of a risk of osteopenia, osteoporosis if you were to continue on with the hormone blocking therapies. Again, it's preventative. There are preventative things we can do for bone health to not ever get osteopenia, osteoporosis, which I feel like is commonly missed in the conventional setting in the conversation around the hormone blocking medications. Again, it's becoming better, but there's just so much to learn, so much to discuss, right, with you. So I understand why some things are being left out. But yeah, we want to look at your bone health. We do that initial bone scan. We want to look at what are you already doing for bone health? What is your family medical history? And then do you have preventative options that you can start right now, which might kind of negate the potential downfalls or the cons of the impacts of estrogen blocking on the bones. So maybe makes it a better choice for you to block estrogen for the purpose of keeping breast cancer away, but you won't have the negative impacts on the bone if you do it preventatively. And then also there's dementia. Things to look at is, do you have a family history of dementia, Alzheimer's, things like that? Are you also, again, younger? And if you're younger and blocking estrogen, you're going to have a higher risk of dementia and when you get older, because we're not having that protective impact of estrogen. And you can even test for a genetic marker called ApoE4, ApoE4. We often will see this on our epigenetic testing that we do with all of our clients. It's something that we really pay attention to in all people, but specifically or especially with women who are on hormone blocking therapy or early menopause, whatever it might have brought on the low estrogen, because we can see if they got this ApoE4 gene, then they're going to be at a very much higher risk of getting dementia over time. So we got to consider that and really focus in on brain health. Further epigenetic stuff on top of like the ApoE4 that you can look at is something called CYP2D6. Basically, this applies mostly to tamoxifen, so women who are taking tamoxifen. So tamoxifen requires conversion by this CYP2D6 enzyme to actually be activated. So if you are a poor or intermediate CYP2D as in dog 6 metabolizer, then you might actually receive less benefit from the tamoxifen, because the tamoxifen, you take it as a medication and then it has to get converted by your body through this CYP2D6 mechanism into the actual active tamoxifen that goes and has the impact of blocking the estrogen from reaching the breast tissue, causing cancer to grow. So if you are a poor or intermediate metabolizer, which we can see on the epigenetic testing, then tamoxifen is probably not really going to help you. So we don't want to give you something, cause all these hormonal chaos things to happen, and it's not even blocking the breast cancer. We want to know that so we can do something better. And we want to know that so that we're not giving you something that can make things worse. It is not conventionally done. It used to be hard to get even done functionally, naturopathically, but now it is an add-on to the typical epigenetic testing that we do with all of our clients to assess. Like, we just make sure, are they on tamoxifen or not, to assess if it's something that might be like tamoxifen might actually not be beneficial for them. And then the other side of that, like the pro side is if you are a normal or like if you are an ultra rapid metabolizer, you're going to do really well on tamoxifen too. Wouldn't that be nice to know if it's really having a really beneficial impact on you? I think that would be good to know too. Other things that might be more epigenetically inclined to assess whether hormone therapy is going to be beneficial for you or not is to look at like liver detox pathways, methylation statuses. These can tell you more about like how do you process your own natural estrogen in the body? Do you convert it into more helpful types of estrogen? Do you convert it into the more harmful, more pro-cancer causing types of estrogen? These are again things to look at on epigenetics. And we can influence these things by applying specific supplements like calcium D glutarate, or we can apply things like DIM. We can look at indoles, like even indoles and all these things and cruciferous vegetables. Like these things can all influence the pathways that we can look at that influence the estrogen metabolism to a more beneficial way for you. So we will get more specific, like you absolutely want to make sure that you take your sulforaphane every day because it's going to impact this particular pathway, or maybe you don't need that. The sulforaphane might not actually help. So that's what we can look at on epigenetics too. The other thing is we want to consider like what are all the other things that you're doing to reduce breast cancer from coming back? Like what does your typical exercise routine look like? Are you including phytoestrogenic foods that have been shown to reduce breast cancer risk? I truly think that assessing for heart health, bone health, brain health, looking at your epigenetics, looking at everything else that you're doing in the world of the best proven research to reduce the risk of breast cancer coming back, this is how we take a more personalized, precise approach to deciding the best therapies for people moving forward. Helps people to decide more thoroughly, should you take the hormone blocking medication or not? So we gotta just stop blanket statement giving everyone this generalized protocol when we do have the ability to dig in a little bit deeper and decide, is this the best choice for you? I will, again, be discussing some of the other nutrition, supplemental factors, all these other things, go even more into what I just discussed already. And I have more to go through still, but everything I discussed already in my upcoming breast cancer freedom workshop. Again, you can sign up and learn more over at flourishaftercancer.com, flourishaftercancer.com/ breast cancer workshop. So you can check that out there if you want to really dive in even deeper into this topic. All right. So the other thing is, like, I guess I kind of touched on this, but it's one of my points. If you're taking hormone blockers, what can you do to manage the side effects? Because there are options out there. They're just not commonly described or discussed. So there are non-hormonal ways to manage hot flashes and joint pain. You can even switch from one medication to another. And we've had so many women who get major side effects from one particular AI aromatase inhibitor, and then they switch to another aromatase inhibitor, and like the side effects aren't there. Or worst case, they switch from an aromatase inhibitor, which might be the best for them, but then they switch to tamoxifen, which is not an aromatase, it's a SERM. They might not get the expected benefit because maybe they're postmenopausal, they should be on an AI, but at least they're on some sort of hormone blocking when they switch to the tamoxifen and they don't have the side effects. So they still get some sort of benefit, but they also don't get the side effects. So we need to assess all of this again and have a conversation of like, if this happens, here's what your options are. Even if you were to, like, if you're still deciding if you want to take the hormone medication or not, you can always take it and then come off of it. And the side effects, the majority of the time, will go away. We have a few that it might not, but honestly, the majority of the time, the side effects will go away when you stop the medication. So all things to consider, we want to look at your options if you were to take them for managing everything we discussed already. Can you do anything preventatively? What would be the reaction if something did present? What would you do moving forward from there? Things I haven't really mentioned, but definitely worth considering as well and worth a conversation is like, what are the impacts of the hormone blockers on your sexual health? And I did a whole episode on this with Dr. Ashley Chauvin. Again, I'll link it in the show notes, but it was very recently, like if not the one before, just before this episode, but it was the one before that one, I think. But I'll link it because we want to consider you having a good sexual health life, sex life going forward too. We also want to consider mood because estrogen plays a role in you feeling happy or not. We want to consider things like urinary problems because estrogen, again, plays a role in continence or incontinence and vaginal health, urinary health. All these things are things that estrogen has a role in. So we need to go above and beyond just considering estrogen is a reproductive thing. It's not just for making babies or giving people boobs or whatever it might be. It really has to do with your overall picture of health, your heart, your head, your bones, your sex life. All of these things are really important and have a great reliance on your estrogen level. So we need to look past just blocking estrogen for blocking cancer. You don't need it anymore because you're not going to have any babies. We need to move past that and look at what is this impact on the rest of your life. Because let's say you assess all of this and you realize that your risk reduction of taking the hormone blocker is you only get an additional 2% risk of cancer coming back. But someone says, they look at your relative risk and it's, oh, you just read it as you get a 50% reduction in cancer coming back. But your risk of cancer coming back in the first place was 4%. So that means you're only getting a 2%. You have a 2% risk of cancer coming back. But you look at your assessment of your whole cardiovascular health and your risk of dementia and your family medical history, and you know your blood sugar is high, and all these things are going to lead you to getting a heart problem, a heart attack, or brain health problems like dementia. Like, is that 2% really worth it for you? And I am so pro medications in many instances when it comes to cancer because we don't have a lot of extra non-medication research. And I do believe the research we have on medications is worth listening to in most cases. But I truly feel like too many women are being misguided with their numbers. They're not being properly, they're not having proper conversations around what does it truly mean to you. And I want you to start having that conversation. I want you to start truly assessing your whole body health, your whole body risk. And that's going to contribute to you making the best decision for you moving forward. So just to recap, 4 big points to bring it all home is, as a scientist, I don't currently feel comfortable saying that there are proven natural therapies to replace hormone-blocking therapies like Tamoxifen, Anastrozole, etc. There's just not enough research out there to say, yes, if you take DIM, if you take sulforaphane, you're going to reduce your risk as great as Tamoxifen. I don't feel comfortable saying that as a scientist. We don't have that information available. As a naturopathic doctor, I do believe we should be helping women to make better, more personalized, more precise decisions when it comes to assessing their risks of not having estrogen in their bodies versus the risk of not taking a hormone blocker and then getting cancer. We can do that. It's so easy. In fact, one of my goals is to make what's called a custom GPT. I don't know if you guys are getting into this AI stuff, but I totally want to make a custom GPT to help walk women through the gathering your numbers and assessing for yourself. What is the risk versus benefits of taking estrogen blockers or not with your whole picture of health? We'll see if that happens. I love tech, but it's hard. It's hard for my brain. I also want to let you know that we do work with women who choose to take hormone blocking therapy and we fully support them. And we work with women who choose not to take hormone blocking therapy and we fully support them. And when it comes down to it, a lot of it is we're going to apply the same estrogen supportive pathways, whether you're on the hormone blocker or not. That doesn't matter as much to us as we are looking more individually at like your heart disease risk, your bone health risk, your brain health risk, and even going a little bit further into epigenetics. That's what more determines the best supplements or the best, mostly supplements, or the best nutrition plan for you moving forward. It's not like, here are the supplements to block estrogen from reaching breast cancer, or here are the best supplements for killing breast cancer cells. That's not how you assess this. You look more uniquely at what are your risk factors and then apply supplements more based on cholesterol. So maybe you should take bergamot because your LDL cholesterol is high, or maybe you should take berberine because your blood sugar is high, because we want to manage your cardiovascular risk because your risk of getting a heart attack or stroke is actually pretty high. We focus more there. And then let's say we look at your epigenetics and we see that you have trouble protecting against estrogen. So we're going to look at antioxidant pathways in terms of potentially some supplements like glutathione, or we're going to look at really making sure you get berries every day, or everyone's going to be put on broccoli. Unless you can't you really don't like the taste, we'll figure out how to make it work. But if not, we've got other kind of cruciferous vegetables that we want everyone to go on with a breast cancer diagnosis. I would say across the board, that is one that we want everyone to do, is the cruciferous vegetables with a breast cancer diagnosis. And then the last thing, the 4th point recap here is, if a woman wants to take a hormone blocker but can't tolerate it, there is a process that you can follow in order to help to better support you on that medication or switching to a different medication, and to reduce your risk of long-term impacts as well. And that conversation is very rarely had. That's something worth discussing with your doctor as well. All right, so that's the main source of information I've got for you. I'm just going to plug, literally it's a plug, the breast cancer workshop because I love this workshop. It is super detailed. It is 3 days of 3 separate lectures going through everything that someone with a breast cancer diagnosis, even if it was triple negative, but mainly today it's going to be ER/PR positive that we talked about, but a lot of this can apply to triple negative people too. But it's everything that I believe a woman with breast cancer diagnosis should learn about when it comes to what can you control in order to reduce your risk of cancer coming back. How can you manage the long-term impacts of menopause or forced menopause or hormone blockers? How can you manage the side effects and symptoms of hormone medications like hot flashes, joint pain, weight changes? Like, what are the natural therapies that have been shown to be beneficial against that? What can you do about that? And also, of course, I'm going to talk about all the best research in terms of the naturopathic approaches and natural approaches to reduce your risk of breast cancer coming back. So reducing the risk of breast cancer growing or recurrence. So I'm going to go through all of that in this workshop. It is going to be super comprehensive. You'll have very great slides to take home. I'll have little bonuses like that relative versus absolute risk and how to interpret your MammaPrint and Oncotype DX test results. I have a handout bonus on the different screening methods for breast cancer as well, the pros, the cons, and different options that might be available that you didn't even know about above and beyond the mammogram. I'm going to have great discussions around any questions that you might have as well, because we're gonna do Q&As. You can ask me questions. So I love this training. I hope that you can see me there. I hope that I can see you there. And it's over at flourishaftercancer.com/breast cancer workshop. All right. Thanks so much for hanging out with me. And here's to flourishing after cancer. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.